Okay, I'm Dr. Onesimo Rwakendera from Tanzania. Together with my wife, Vedastina Teralire, underwent treatment since 2019 till today. I came to know Apollo Hyderabad through my friend who was operated here 2004. He was suffering carcinoma of the esophagus, and he attended by Dr. Bandari, who did a major surgery, and then that surgery was eventful, and the patient recovered well, and he was discharged to go back home. After arrival at home, he had a major complication because it was not ready to be attended in Tanzania, in East Africa. And they forced this gentleman to come back. And I was called by a relative to come to advise regarding that surgery. I read those notes, and myself, I couldn't first believe somebody with a carcinoma of the esophagus. There's no any surgical scar on the chest, but there was a small surgical scar on the epigastric area. I read those notes, and that gentleman, after surgery, there was a collapse from the surgical site. As a result, he was not drinking or eating anything. Everything was he was vomiting. Now, I decided, because by that time we didn't have mobile, we were communicating through the email. I remember it was 24th of December. I wrote email because there was the emergency contact from that paper, which was a discharge paper. I wrote email and from the Tanzania to emergency Apollo at Hyderabad. Lucky now, after 2 days, they respond to me, and they ask that if there's a big hospital around your country, they can go there. It's a small procedure. Now that patient travel from almost 1,005 kilometers to go to capital city, by that time Dar es Salaam, to seek medical service at the Aga Khan Hospital. Then at the Aga Khan Hospital, they read the notes, and they say they can't attempt on that one. They ask Aga Khan Hospital in Nairobi, also they have the same answer. And now I contact him again, he said that's happening. Now I ask, okay, can the patient manage to fly up to Hyderabad again? I say we can resuscitate him, and then they can fly. Okay, they fly, they came here, thank God they came here safely. And it was like office procedure, and immediately that gentleman recovered well, and God grace, until now that gentleman is still alive and in health condition. From that day, I started to have a contact with Dr. Bandari from Tanzania, and I refer many patients from him, of whom more than 90% they have a success. And I went to surgery, and then chemotherapy, and they came back with a good health. And recently, I had my wife who had this problem with the carcinoma of the breast, right side, which was diagnosed in 2008. And at home, they did a simple mastectomy, axillary lymph node dissection, and then they started there on chemotherapy, 6 courses, and radiotherapy. And after that one, they started on tamoxifen. We finished the course of tamoxifen after 5 years, and then they proceeded to monitor her. But unfortunately, after 11 years, she started complaining about pelvic pain. We took X-ray at our place, which showed that there is a lesion on the right lami, and we did a bone scan also. We did a CT scan before bone scan, which showed that the tumor was metastasis, and then we did a PET scan, and we did a bone scan at our place, but it was unfortunate we couldn't manage to confirm is it metastasis or not the other diseases. As usual, I contacted my friend Dr. Bandari and I give all the information. What he advised me, he advised to come 2019 in November to come to Hyderabad Apollo Hospital for further investigation and possible treatment. On arrival, we found a friendly team from the Reception International Office, and as well as my colleague, Dr. Bandari. They did a PET scan and then they did a biopsy from that aspect. And it was confirmed this is a metastatic malignant. From that one, they decided they make a consultation with the seniors, the vice president, and then he decided to give her radiotherapy. And after radiotherapy, we started the chemotherapy, and we went back home. And since then, all this problem, pain and everything, it was completely. But recently, when he came to Tanzania for follow-up with the patient, of course my wife, she managed to meet him. And after meeting him, they did a basic investigation. But unfortunately, bone scan was not done by that time because it was a short period, short time. And they advised me, please do bone scan and give me the results. And unfortunately, we didn't have reagent, we didn't have that nuclear materials. And we took almost 1 month, and then we managed to get one of the consultant hospital. When they did this bone scan, they found there was a bone density, like a dot on the left side of third bone. And then I gave them the report, and fortunately it was almost to start the medication that there could be a metastasis, but insisting, please come to Hyderabad so that we can repeat the PET scan. And we arrived on Monday, although it was a bit late in the morning. As usual, although it's so busy, but he asked another doctor as well for us to do some investigation before the PET scan yesterday. And the PET scan yesterday was done, which was successful. And this afternoon, we get the result at 2 p.m. And good luck, thank God that the result was negative, there's no sign for metastasis. And they advised us to continue with the previous treatment. And they asked her if we can go back home. And me and my wife and my family in Tanzania and the relatives, we really thank Apollo for everything which is done to us, also to other Tanzanians and all people in the world. Thank you very much. I would like, last but not least, I would like to thank Dr. Bandari and his team for hospitality and the management they show us until we get that results. Thank you very much.